Good morning, students. How are you doing? We're so happy to have you here. We're going to ask everyone to mute yourselves. Welcome, everyone. We're so happy that you're here for our exciting Cybermentoring for March. I don't know about you all, but the countdown is on to the end of the year. Everyone's excited to finish up the school year and have some summer break coming up. I'm counting if no one else is. As soon as spring break is over, I'm looking forward to summer. So I want to welcome everyone to the Paths Project Cybermentoring for March. It's March 30th, 2021. And today we are welcoming Mr. Kareem Abu-Hala, and he is a NICU nurse
thing already popped up, so
nursing educator.
Bye.
We're going to ask everyone to mute yourself. I do want to let you know that we are recording this session. And for now, we're just going to talk to Kareem, and then we're going to open up the chat and allow questions to come in. So I'm going to turn it over to you, sir. Begin.
All right. Thank you very much. Good morning, everybody. My name is Kareem Abu-Hala. I'm a nursing educator for NICU and nursery here at Women's Hospital Renaissance. I've been here for 12 years with DHR, 9 years as a registered nurse. I went to South Texas College to get my associate's degree in nursing.
And did you do the RN or the LVN program?
I did go straight to the RN.
You went to the RN.
Yeah, I went to the RN program. There is an LVN program there, and there's also a bridge, so you can go and get your LVN and then transition to the RN. I'm sorry, I'm trying to read my PowerPoint at the same time. Let's see. So initially I did maybe 1 to 2 years of school. Of course, everybody's kind of getting used to doing online classes, you know, for a lot of people who might need to work or, you know, need to work to pay for school. Right. They do have a lot of online classes at STC as well. I paid for all my school out of pocket. So I did have to work and go to school at the same time.
And how did you find that? Was that difficult, I can imagine, or how did you handle working and going to school?
Yeah, but by all means, I couldn't have done it without a lot of support. So I did work in the same NICU that I'm at now.
Oh, that's nice.
So I was a unit clerk. Unit clerk is more or less like almost like a secretary, you know, like you kind of answer a lot of phone calls, clean some equipment, etc. And I had like a lot of very, very flexible kind of jobs that I did. After that, I became an EKG tech there, and I would just go and check the baby's hearts, and that as long as I was there in the morning and I was there at night to kind of like do all the, you know, stocking and everything for the respiratory department, I was able to kind of balance work and school. So I mean, by all means, I wouldn't suggest doing it. It was very, very challenging, but you know, sometimes you have to, but it's possible to do both at the same time.
So you were at DHR when you worked?
Correct. So I joined DHR in 2009.
Okay.
I was 22 years old.
Okay.
And that's actually where I got exposed to the NICU. So I knew I wanted to be a nurse, but I had no idea I wanted to deal with the babies. So NICU, guys, is a neonatal intensive care unit. So we usually see babies are typically born full term at 40 weeks. We see babies from as young as 22 or 23 weeks, all the way up to 40 weeks plus. So a lot of times these babies need to get a little bit of additional help and support to kind of make sure they're ready to go home and be taken care of by their parents.
Okay. And did you find that the work environment was very supportive for going to school and working?
Absolutely. Yeah. So, I mean, like I said, as long as since I had that EKG tech role, there was only a couple things I had to do each day. So in the morning, I would do all the tests. So I would check all the baby's hearts. And then in the afternoon, I would just need to kind of maintain, all the supplies and everything in all the units. So like it was
Right.
very easy for me to come in maybe for 2 or 3 hours, go to school, and then go back that night for another couple hours. So I mean, I'm sure you can imagine it was like I kept my full-time status even, but I mean it was kind of a grind, but like sometimes you just do what you have to do because I unfortunately didn't qualify for financial aid, so I really had to try to pay it out of my own pocket.
And the flip side of that, how did you handle your schoolwork since you were working?
Staying up late. But nursing school is a little bit demanding, but
Yes.
really I feel like if you focus your attention on it, even if you don't have a lot of background in it, or you like you didn't get a job in a hospital setting beforehand, if you just go to if you commit to the RN program, there's a lot of resources available for you, like tutoring, etc. And a lot of the times the friendships you meet there, because it is so challenging, the friendships you meet there and the little study groups and everything, that kind of like
Right.
stays with you. So you get a lot of help from other people who have a similar goal.
So let me think of the flip side of that. Were your instructors supportive of you working?
No.
That's
So
you
they
would be
actually
very
recommend
honest.
they recommend that you don't work. And if you really, really don't have to, like you don't have to support yourself or help support somebody else or your family, I would suggest not working, just focusing on it. Because once you finish school, and like that's the main challenge here, because it is a little bit like a lot of information. Like once you finish school, trust me, you'll have enough money to kind of like do what you would like to do.
Right, right. So there's sacrifices if you work while you're in the nursing program.
Correct. So I
Um,
mean, could I have done better in nursing school? Absolutely. If I didn't have a lot of things, if I wasn't busing myself back and forth, but I mean, you kind of like I would recommend not working just to make it easy on yourself, because it can be stressful sometimes, the amount of things they can ask from you, but 100% it's achievable.
well, that's good. Tell us a little bit about what your day-to-day job is like.
As a nursing educator, or when I was in NICU?
When you were in NICU, let's start with that.
All right. So in NICU, usually, typically you get assigned babies. So I'll show up to work, and your babies might be, you know, big babies who just don't know how to eat.
Mhm.
They don't know how to feed, or you can get a very, very small baby who needs like full support, has a lot of IVs, etc. So you'd get in, you'd find out which babies were assigned to you, and that usually goes by experience. So the longer you're there, the more critical of babies like you should be kind of seeing. You get report, which just kind of means like you get an update of the previous shift, you get an update of where the baby is since birth, and then you kind of just do your daily assessment, your daily work, which really, really all goes off of just assessment. So you see this baby, and like once you have the experience, you should be able to identify any changes in the baby's condition. So let's say all of a sudden your baby stops breathing, which a lot of them like to do, but it's happening more and more often. We can kind of report that to the doctor and say, hey, lately my baby's kind of been taking big pauses in breathing. I have to keep kind of like waking him up to breathe. We went up on the oxygen, etc. Like maybe it's time to, draw some blood and check to see what's going on. So really the whole point is, of course, someone's with the baby 24 hours a day till the baby goes home. And really you just try to make sure that the baby kind of continues on that path and doesn't have too many steps backwards. But I mean, things do happen. A baby gets sick. Of course, some of the preemies that we deal with have very, suppressed immune systems. So a lot of times if they do get sick, just from whatever, from their parents visiting from straight from work, or us not washing our hands, or whatever happens there, you just kind of need to be able to identify it and report it. And a lot of the times you do have the cool thing is you do have like the opportunity to even start an IV on these little tiny babies.
Mhm.
To feed these little tiny babies, you get to interact a lot with their parents. A lot of the times the parents have no idea that what to do. They have had 3 babies that were totally, full term and went straight home. And now they have a baby that's going to be here for 2 months. So a lot of it's interacting with the parents too. So,
Right.
and a lot of the times I feel like they're very, very grateful for what we do there in the NICU.
I had a baby in NICU, and I will
Yeah.
tell you, I was very, very grateful. He was there for 2 weeks, and I was very grateful for the support of the nurses that were there. So I agree with you. So tell us about your transition from the NICU and the nursery into nursing education.
Okay. So for the last 4 years before joining nursing education, I was a charge nurse.
Okay.
Charge nurse is usually, once you do have that experience and maybe they trust you, you have good decision making, you have like good critical thinking, you think quick on your feet. You can start being trained as a charge nurse. So I was a charge nurse for about 4.5 years. And I realized that there were a lot of new nurses getting hired. A lot of the night nurses moved to days. I worked nights. They moved to the day shift. A lot of them went back to school. Some of them quit. So I was kind of seeing that a lot of the new nurses maybe had, you know, could have been, I guess, like trained, like guided a little bit better.
Okay.
So I decided to kind of go into nursing education more to help kind of guide the new nurses coming into the unit, as far as just mentoring them, kind of getting their mindset right. Like it's just funny. There's like a lot of misconceptions about nursing as
Mhm.
far as, skill level and, who's important and who's not. And, sadly, like the younger the nurses are, sometimes it's a little bit more, it's a little bit more, there's a larger emphasis on the social aspect.
Mhm.
But for the most part, I really, really wanted to take a bigger role in kind of making sure all these nurses are ready to step onto the floor. So you guys go to school, you guys become RNs, you do get into NICU. Who knows? Maybe I'll still be here. Maybe I'll still be here to mentor you. The cool thing about NICU also is, even though it's an ICU, so it's an intensive care unit, even though you deal with babies that you'd be surprised, they're no bigger than your forearm. So they're as long as from your wrist to your elbow. I don't know if you guys can imagine that. But we do actually, straight out of school, if you have your RN, we do like hiring new graduates.
Mhm.
The unit's always been good with that. I was hired as a new graduate. I didn't have any other experience. I never went to nursery. I never went to pediatrics and took care of like older kids. I just went
Mhm.
straight to NICU. And they do like teaching the new grads, just to kind of teach them the right way to do everything,
Right.
instead of kind of taking an experienced nurse who might have some bad habits that need to be
Mhm.
changed.
Mhm. Well, let me open up the chat then, and I have to change a setting to do that. And I think I probably have students who have questions for you. I'll be happy to read them because they won't see them in the recording. So,
Okay.
what's been the worst experience in your career?
Um, Probably, I mean, I don't want to be too grim or anything, but probably losing a patient.
Yes, I can
So
imagine.
sometimes you go to a delivery and, the mom is just having an emergency. Everything was fine. She's 23 weeks pregnant only. She comes in, she delivers in an emergency, you go, and just the baby just doesn't make it. And I think those are kind of like the sad things. One of the like more sad things is premature babies. You kind of understand, there is a risk there to being born so
Right.
premature, but I think the most sad ones are when it's a full-term baby. So it's just a car crash or something, and mom comes in and turns out the baby didn't make it. I think those are the most sad experiences you can imagine.
And difficult, very difficult. How is the working environment for nursery nurses? And can you describe a time where you were concerned about the well-being of a child, and how did you handle that?
In nursery,
Yes.
So I've never actually worked in nursery, but I've been around there as an EKG tech. I would always go there to check the baby's hearts. But the working environment is more nowadays. Uh, they're really pushing every baby, healthy newborn baby, to be with their moms.
Yes.
So a lot of the times you'd be surprised. You have a nursery nurse really not being with her patients at all because they're with the moms. But there's just a lot of, I guess, bringing the babies to get checked, drawing some labs for the babies, getting the baby ready to go home and assess. So I think in the nursery, it's kind of cool. You get to like walk around a lot, meet a lot of the other people in the other departments,
Yes.
Get to visit a lot with the parents and the parents' families, of course, before COVID. Before they'd have like 10 people in each room,
Yes.
but but nowadays, it's just one or two. But so nursery is actually just pretty interesting in the fact that you get to keep moving. You're not kind of tied down and stressed out. I forgot the second part of the question.
That's okay. You just brought something up that begs for a good question. How have things changed in a nursery and in the NICU and with new parents because of the pandemic?
So just because of the pandemic, really, it's just visitation. So when things were really, really strict, the thing that we were most afraid of is a baby getting COVID.
Yes.
Or we were also scared of one nurse getting it and then taking a lunch break with all the other nurses. And then next thing you know, there's no nurses for the babies. So for the most part, we did limit visitors. It was kind of like one parent a day and only the same parent. Now we went back to two parents. But you'd be surprised, even if a mom is COVID positive, the babies always come out negative.
Okay.
So it never actually transferred to the babies. And, and I'm sure you guys have probably heard too, like not a lot of the times that like kids or young kids are too affected by it.
Right.
So it was okay.
Okay. The next question, do you ever get frustrated with the crying babies? And if you do, how do you calm yourself down? My question would be, how do you calm the babies down? But how do you calm yourself down when you're frustrated with the babies?
No, 100%. It does, especially like if you're busy, you've got your gloves on, you're doing some kind of procedure, you're starting an IV, and then you have your little baby neighbor over there screaming his head off because he's hungry and he's not allowed to eat for whatever reason. You'd be surprised that the more time you spend with them, putting them to sleep and getting them nice and comfortable, is the more time they stay asleep and be comfortable. So I've seen a lot of nurses, even in my unit, like, they just come by, they take the pacifier, they pop it in the baby's mouth, baby starts sucking the pacifier, and then they just leave. Like I find it best to actually just spend a little bit more time with the baby.
Right.
And if you're, I'm assuming nobody here is obviously, or maybe not too many, or
parents
have experience, with like
right.
little babies at home. But putting a baby to bed is kind of just, it's like a skill.
Right.
So the longer you spend with them, I feel like the longer they stay asleep.
Yes.
So just do the work, put the time in, and they should stay asleep and not be crying too much.
So what part of your job do you find the hardest?
On the floor, when I was like maybe charge nurse, I think the hardest part was going to deliveries. So if a baby's, totally normal, mom had a normal pregnancy, there's no risk factors there with her, I wouldn't go to the delivery. As a nursery nurse, if you guys do decide maybe, I don't want to deal with these little small sensitive babies, you want to go to nursery, there's another cool thing in nursery that you get to be a baby catcher. So instead of actually getting a bunch of patients and seeing the moms and things like that, you can actually go to all the deliveries and do the whole initial, hey, let me get the baby. I'm the first one to see the baby. I'm going to dry and stimulate. I'm going to make sure baby's breathing fine. Everything's okay. Baby can stay in the nursery. And you get to experience like all these deliveries. So I think going to a delivery that turns out bad, or there's like a lot of risk factors and it's just, the unit's already busy and all the babies are already sick. And then now you have this little tiny 25-weeker showing up. I think that's probably the most difficult part of the job.
Right. So they're asking a little bit about your background prior to even going to school, when you were young, or when you were in middle school or high school and you were thinking about what you wanted to do for your profession, was there anything that made you choose this? Was like, why did you do this? Why did you go into this?
Um, I would just say like it was more of just like a family thing. So my mom's a nurse.
Oh, okay.
And you hear all the time, guys, like I know a lot, like I'm sure there's very, very popular careers out there that a lot of people want to go into, you know. I hear all the time people like want to do art or music or something, but there's no real good jobs out there, good paying jobs out there. But nursing was always kind of like everyone would always say, there's always going to be a job for you. There's always a need for nurses. You can do anything. Honestly, in nursing, if you get tired of one thing, you can literally just go do something completely different.
Right.
So a bunch of options is if you do want to take care of patients in the hospital, go try to work in the hospital at one of these units, maybe an age group that interests you. If you want to work with babies like me, try to get into NICU. You wanted the most difficult patients of all, go to like neuro ICU or adult ICU. If you are tired of the patients, you can literally just be a nursing educator. And now I'm more with the nurses instead of the babies or instead of the patients. What else? There's home health.
Right.
You can literally just be in your car, drive house to house and, go see patients in their own home. There's legal nursing. There's even like informatics. So it's more of like a techie kind of area where you maybe work on like the whole computer aspect of like nursing charting and things. So, I just really like the flexibility of the nursing. So I got introduced to it through family,
Right.
I guess. But then when people tell you, hey, and you make a lot of money,
yeah,
and you can travel, they'll pay you extra and they'll pay for your hotel and they'll pay for your food and they'll pay and you won't get taxed or, whatever, if you travel to another country or whatever, so, I mean, there's really like not too many downsides. Like I think the biggest downside to nursing is probably the schooling, but a lot of the time, if you're just focused and you're motivated and you're not just doing it for,
the money,
whatever, yeah, for the money, you care about nursing. Hey, I really want to be a nurse. You can 100% achieve it.
Yes. Can you elaborate more on the social structure when a new nurse comes into a unit? What can they expect?
So I would say sometimes, I think like anywhere, what age group are we presenting to?
There may be some middle school, but they're mostly high school, so 9th through 12th.
Okay, so I'm sure you guys kind of know social issues in middle school and high school. Honestly, it kind of carries itself into the professional area. So I would just expect it to be, for the most part, everyone has the same goal. You all want all your patients to get better. Some people are just, been doing this job for too long. Maybe they're not so helpful, but I would say just find the people who are more willing to help you and more open to helping you, and kind of like, kind of just stick with them. Like, don't fall into like the drama. Don't fall into, the bad social aspects of just working with other people in general. Because remember, I mean, anybody could be a nurse. So, I mean, just because I'm nice doesn't mean the person next to me is having a good day,
right,
or whatever. So, I would just say just the same social issues in everyday life. So it's 100%. You can have a drama-free work environment.
Right.
100%.
So is being a nurse stressful at times?
Absolutely, but it's fine. The main thing I think is to go to work, do your job, and then do your job to the best of your ability, and then just kind of like go home. Don't take it with you. Try not to talk about it too much outside of work. Oh my God, this happened, blah, blah, blah. Take your breaks. The cool thing also about nursing is most of our shifts, especially in the hospital, are 12-hour shifts. So once you work 3 days in 1 week, you're done. Unless it's really, really busy, they're offering overtime. So you can like literally work 3 days. So you can work Sunday, Monday, Tuesday, and then be off Wednesday, Thursday, Friday, Saturday, and then work the next Sunday, Monday, Tuesday, and then be off Wednesday, Thursday, Friday, Saturday. You can work Thursday, Friday, Saturday, Sunday, Monday, Tuesday, 6 days in a row, and then be off for 8.
Wow.
You can like literally go on a vacation after every 6 days. You can go on an 8-day vacation. So I would say, like, yes, it's stressful, but you have so much time off that you should really take advantage of.
So when you say 12-hour shifts, how do they break up the day?
So it's just 7 a.m. to 7 p.m.
Mhm.
or 7 p.m. to 7 a.m.
So it's either a day shift or overnight shift.
Overnight shift. So each one has like its perks, you know. Day shift, you live a normal life. You get home, you can still go shopping. You know, you can go to the movies, whatever. Go out to a restaurant, eat. Night shift, you get out of work and usually everything's still closed. And if you want to stay up a little bit to like go to the bank or whatever you need to do, go food shopping. You know, next thing you know, it's 10, 11 o'clock and you don't sleep the same during the days as you do at nights. So it's a little bit.
What's the longest shift? Have you ever had to work 24 hours or more?
Oh no, I don't think we're even allowed to unless you're maybe in a more advanced role, guys.
Right.
So I mean, even if you want to become an RN and you want to take it, that's another step further and become like almost like do what a doctor does, and you want to become like a nurse practitioner. I think a lot of the times, like especially in our unit, they do stay for 24 hours.
Okay. How do new mothers who have babies in the NICU bond with those babies?
So there's a lot of ways. We encourage a lot of parental involvement. So if they show up and they're freaked out, they don't want to touch the baby, whatever, we really encourage them like, hey, you know what? Like, we'll be together. Like, I'll show you kind of how to hold the baby. I'll show you how to wrap up the baby. We'll show you how to feed the baby. A lot of the times, what we do is called kangaroo care.
Okay.
So kangaroo care is more like a skin to skin with the mom and the baby. So usually, even if the baby's like very, very small or whatever, as soon as the baby's really stable enough to be held by the mom, we kind of have the moms like wear maybe like some kind of like button down blouse or, you know, even a t-shirt or something like that. And we literally just slide the baby into their shirt and they just have that kind of contact, that skin to skin contact that the baby should have if they were born, you know, a little bit healthier. But we always encourage that. We encourage moms to breastfeed if the baby's able to. Even if they're not breastfeeding, the moms are very involved pumping their breast milk, and we feed it to the babies when they're not around. But for the most part, we do encourage a lot of like the physical bonding.
So what's the dynamic when there are multiple babies in crisis at one time in the NICU? I think the best thing is to talk about maybe the ratio of babies to nurses.
Right. So every time you come in, you can have a maximum, at least in level 3 NICU. So there are 3 levels. Okay. So the 1 would be more like the nursery. 2 would be kind of babies that are ready to go home. And typically there you'll have maximum 4 babies to take care of in one night. And then in NICU 3, you have anywhere from 1 baby only to 3 babies maximum. So some nurses will come in, super sick baby, could go bad at any point, you know, it's kind of like at risk if like you mess up. So the more experienced nurses get one patient. A lot of the nurses get 2. Sometimes 2 is enough, like it's 2 very, very busy babies, like they're still need a lot of work. Or sometimes you get 2 pretty easy babies, but then you're on what we call admission. So in order to prepare for situations like that, where let's say triplets just show up and you have no nurses, typically we have like a first admission, second admission, and third admission. So those nurses are kind of like on standby to receive the first 3 babies that come in the NICU. Sometimes no babies come. You just kind of have like your easy babies and they're like, hey, well, you're going to get the first sick baby. And you're like, oh, no baby came, you know? But sometimes, yeah, in emergency situations, everybody's really, really good here at our NICU. Like we have 3 main doctors, but several doctors will come in if needed. Several nurse practitioners will come in if needed. Now that I'm in nursing education, I've helped when needed. Our director helps when needed. So we do have things in place. Like if there's just some crazy emergency that, we have the help that we need.
Some of the students have just started joining us because, as you can see, we just passed 11 o'clock. So one of the questions is, how many years did it take for you to get where you are now? So if you could go through your education again after you graduated from high school, what did you do?
So I made the mistake of not going to college straight after high school. So you say you're going to take a break, you're going to take a year break. 1 year turns into 2 years. Then you're going to get a job to save up for a car. And next thing you know, you're buying yourself stuff and et cetera, and you kind of like lose track of your school.
It's hard to give up that money once you start making.
Yeah, exactly. It is. So, I would say the main thing after school is really to just keep going to school. If you could just kind of hold off on the job. I mean, if you could start making, like really good money and have your career and everything when you're like 22, it'd be way, I guess you have like such a cool future to look out for, than me when I started when I was 22, pretty much. And I finished when I was 26. And that's because I went very, very slow and I was working the whole time.
Right.
I feel like if you just go straight after high school, you don't start working and trying to buy yourself a car and buying yourself like shoes all the time or, sneakers or whatever. Then I feel like maybe that's the best way to go.
Right.
But it took me about 4 years total. So I spent about 2 years doing my prerequisites because I took only like 1 or 2 classes at a time. And then I went to the nursing program, which is pretty much like more or less like 3 or 4 semesters. So, and I think they call it like level 1, level 2, level 3, and level 4. So it'll just be like a spring, a summer, a fall, and a spring. So it's kind of like a year and a half. Or you can do spring, fall, and just kind of skip the summers if you don't want to do that crammed in summer. Because that crammed in summer, they'll have you at school like 5 days a week.
It's tough. It is very tough.
Yeah.
If you could go back in time to the beginning of your journey, what advice would you give yourself? That's a tough one.
Keep doing what you're doing. No, honestly, I've had like a very, very easy time. Like really, I think the main thing to do, especially like when you work with like sick patients in any age group, is just to really go in and just be about the job. So I went in, my main concern was the babies. My main concern wasn't, making friends or gossiping or, making relationships,
right,
outside of work and things like that. So, I mean, like, I just went in, I did my job. I never asked for anything. If I didn't like the babies that I was assigned, because they're the babies nobody wants, for example, because they cry a lot or they're very, very difficult or, whatever it may be, I would just take the assignment. I wouldn't say no. So I just really, really just put my head down, did my work. People noticed. I got the recognition that I wanted just from, letting my actions speak for me. I became a charge nurse just from one day to another. They said, hey, we're going to train you as a charge nurse. We like the way you think. We like the way you work. So, and you just try to just do your best job. But I've had a very, very good experience. And I would say try to stay away from the drama because, anywhere you go, there's always that one person that tries to make things difficult or is bored and wants to start a rumor or, but I stay away from all that.
I understand. Have you ever had to deal with a difficult mother?
Well, yeah, a lot. and it's not because, they're trying to be difficult. NICUs is one of the most stressful places, I think, for parents. And sometimes the workers, but with parents, I think there's even like a high divorce rate of parents when they have a baby in the NICU. So a lot of the times they don't know they're being difficult, but I think their main concern is just their baby.
Right.
So, sometimes there's a clash of heads or, hey, I don't like the way they grabbed my baby. Like maybe that was like, you know, they don't know how we carry babies. Like a lot of the times they're so small. You just literally like grip the back of the back of their head or their neck, and then you just like grab their legs and then you hold them like this. But you know, like a lot of times, like even there's just a misunderstanding that leads to a parent being kind of difficult. But customer service is like number one.
Right.
You should be able to diffuse situations. If it's just a clash of personalities, like the mom's not getting along with you, you know, you can always change the nurse that's taking care of the baby, or you can have somebody else step in. So a lot of times I would have to diffuse a situation. So funny story, one time, we had parents who wanted to keep their baby's umbilical cord. And I don't know if you guys know, but umbilical cords, eventually they just kind of dry up and fall off.
Right.
So I think the baby's umbilical cord fell off. The nurse, I think, threw away that blanket or that whatever, the umbilical cord went missing. You know, I had to go downstairs. They were like, I think she threw it away on purpose. And you just have to kind of tell them, like, look, like no one would do that on purpose, you know, but we did everything we could to try to find it, digging through trash, even, you know, but sometimes there's just like a misunderstanding like that. But a lot of the times I feel like it can be like you can smooth things over again, even by just having someone else step in.
You're not going to believe that one of the next questions is, what is the funniest moment in your career? That was one of the questions coming up.
Yeah.
So I can imagine.
That's probably one of them. I mean, really just the accusation of, I think you threw it away on purpose. I was like, no,
we don't do that.
No, we don't do.
So you brought up something and it's one of the next questions. So you are a male in a female dominant industry.
Correct.
So do you have anything that you can talk about, and how do you deal with, if there is any sexism, how do you deal with that?
Okay, so it is difficult for guys in nursing, 100%, especially when you deal with babies. I think the biggest misconception is if you're a guy, that you're not, like, you don't care, like you don't have compassion for the parents of the babies, you don't have empathy for what's going on, like you don't, like you're just there for money or, you know, whatever. Like, and I feel like a lot of the times that's a misconception they do have. And the funny thing is, girls and guys, I see it all the time. A lot of them, like, you know, there are nurses out there who really are doing it for the wrong reason. Like they're just doing this as their job. Their main interest is like saving money so that they can, like, you know, pay for their Mercedes or whatever they need to do. Like, you know, but like for the most part, men, I think, have a lot of like stereotypes that they're not carrying. And I've even seen it, you know, like in our unit, maybe there's a guy who actually is like that.
Right.
He doesn't care too much, you know? So, I mean, for the most part, you just have to kind of like battle those stereotypes. We do have a system here at the hospital that if there is any like really like, you know, harassment or something like that going on in the hospital, you can actually just do like an anonymous report. And they'll kind of call it to attention to your director and human resources, and then you can actually kind of address these things. But I don't think if you're a guy, you need to be scared of going to the hospital. A lot of times also nurse, you know, you tell people you're a nurse and they're, oh, isn't that a girl's job? Like, not anymore.
Not anymore.
You see a lot of guys nowadays. Before, maybe one or two a shift, it would be guys. Now, honestly, there's probably like 4 or 5 that we have there, especially in the ICU, ICU areas. We see a lot of men like go more towards intensive care. But yeah, that's it. I can't even say I see too many men nurse practitioners, you know, but I think by all means, like every role is for every gender. And if you do deal with any sexism, it's not your fault. It just needs to be addressed. You know, your boss needs to get involved. The job needs to get involved. There's been like, you know, sexual harassment even from some of the male people to females, and they deal with it like any good business would. You know, they either move that employee or they get rid of that employee. So it's the same, like they expect you to be super professional, and really sexism and harassment and stuff, it just really isn't like tolerated. But there are like little stereotypes you need to get past, especially if you're a guy going into nursing.
Right. I think it bears repeating that most places of employment have procedures in place when things become out of hand.
Oh,
And
exactly. Like even in
investing-
school.
Yeah,
You
exactly.
can't just go around and,
Say whatever you want.
shout something at that girl you like, So, I mean, it's kind of like the same thing as far as like if you're a female and you're going to, let's say you want to go into ICU and you're a female, and a lot of the guys go to ICU, and feel like there's a lot of sexism if you're a female going to ICU or if you're a male going into taking care of babies. There are certain departments that men usually just don't go. And I would say labor and delivery. I don't think there's one male nurse, and that's just more personal. Like moms are delivering babies, and so a lot of them would probably have preference. Hey, I just don't want extra guys, checking me or whatever. So, like there are limitations, but I would say like they all have like things in place to.
Well, there's a question that kind of deals with that. How do you deal with parents who have either religious or preferences in the way their child is cared for or the mother is cared for?
Okay, so I have a really good example of that. So I would say Jehovah's Witness. If you're Jehovah's Witness, you can't receive a blood transfusion.
Yes.
There's even a case so we do have something called an arterial line. Okay. So that's a catheter, like a kind of like a tube or whatever, like an IV almost, that's inserted into an artery, and then you can draw blood from that.
Right.
But usually what we do is we have fluid going through there, so the blood doesn't clot. And then when you want to draw the blood, you have to take out a little bit of blood, and then draw the blood that you want to send off to the lab, and then you have to put the other blood back in. You're not even allowed to put that blood back in, technically. Oh, okay. Jehovah's Witness, because they say like it's just kind of like contaminated or whatever. But in emergency situations, for the most part, we do try to cater to these parents,
right,
and respect their religious beliefs. But in emergency situations, if the baby absolutely 100% needs it, they'll do this thing where it's like I don't know how the process really happens, but what we do is we pretty much take custody of the baby for just during the blood transfusion. And then we kind of release it. So even if they say, hey, you know what, I didn't want a blood transfusion, why'd you give my baby a blood transfusion? We'll kind of have this legal paperwork that says we did it to save your baby's life.
Right.
So absolutely 100% it was necessary. I've seen a baby before get maybe one blood transfusion because he was so small. And then after then, they were just so careful about how much blood they drew. Because the more blood you guys take out, honestly, and the more labs you draw, the more blood you have to replace.
Right.
So we really, really tried to not poke this baby at all. And honestly, baby went home without any other blood transfusions. So I absolutely respect the religious beliefs of the parents, unless it's 100% necessary.
Right. So the equipment that you have in NICU for the babies, I'm assuming, is different than you would even have in pediatrics. And can you tell us a little bit about that equipment?
Okay. So when babies are born, one of the main things that they have difficulty doing is keeping warm. So one of the main pieces of equipment that we use, especially for the little babies, is we call it a giraffe. It's made by a company. It's called a giraffe. I think it's made by GE or something. But it's literally like an isolette. It's a bed, and it has a top that raises up and down. You can even add water into the machine, and it humidifies the air and kind of keeps the air real warm and moist in there for the babies. So that's one very, very important piece of equipment that I don't think anywhere else has, because the babies we have are that small that we need to kind of keep them warm and as similar as being inside mom still, because they were born so early, as possible. We have a variety of just tools, the way we make our beds. It's kind of just like arts and crafts, kind of. We fold these blankets in a way to make them beds. We make them little pillows out of other pillowcases and things like that. But a lot of the times you'll only see that in the NICU population. Everything's extra mini. Okay, so I'm sure you guys have seen a blood pressure cuff before. If someone wants to take your blood pressure, there's a blood pressure cuff about this small. that just wraps around your finger. You know, but a lot of the equipment is just miniaturized, like super, super miniaturized. And I would say like the warming measures, like that's kind of the equipment that only we have that no one else has.
So is it difficult to work with such small equipment?
Oh no, like the equipment's okay. Um, it's hard using all these things on the babies. And I'm not joking. Like if you look at your pinky, like sometimes their arm is like about that thin, you
Mhm.
know, so it's very, very hard to get an IV into one of their veins, or, you know, you even try to, when babies are born very, very early, like 22 and 23 weeks,
Mhm.
their skin is so sensitive. You can't even put, I'm sure you guys have seen like the little monitoring devices, like the little stickers that they put on a patient, like a person's chest, to just watch them on the monitor. It's hard to even put those on a baby because if you can't remove them. Once you remove them, their skin kind of comes with it, you know,
Yeah.
like very, very sensitive. So a lot of the times, like those are the challenges.
So let's talk about your job. So what's the best part of what you do every day?
I feel like it's just maybe the satisfaction that you get. I'm telling you, like once you kind of make that relationship with like the parents of your baby,
Mhm.
you know, it's one of those things that, you know, I mean, I don't recommend it, but you know, like I don't know what the legal thing is of it, honestly, in the hospital. But afterwards, sometimes the baby goes home. You made really good friends with the parents. They'll keep you updated sometimes. They add you on Facebook or whatever. And like you just kind of get to see this baby grow, you
Yeah.
know, and still to this day, you know, I see a baby and I say, I can't believe that baby was that small and just looks like so beautiful,
Mm.
running, playing sports, whatever. And I mean, I've been here for 12 years. So some of these kids are, who knows, in middle school,
Right.
you know, some of them may be like almost about to be in high school. So, you know, I think a lot of satisfaction is just when you see that the kids grow up so successful, parents are so happy, things like that.
What are the biggest challenges on your job?
To not like noticing everything, not missing anything. So
Right.
sometimes you might miss something. You send some labs, and if you don't check them and you don't report them right away, if it just goes missing, then you know sometimes something happens to your baby that you didn't want to, that they could have intervened. Um, Medications. So the main things, guys, that people get in trouble for, okay, is maybe
Uh-huh.
giving the wrong dose of medication. And nobody's perfect, you know, everybody makes mistakes, but sometimes they order like a wrong dose for a baby. And so that's the doctor or the nurse practitioner ordering it wrong. Then it goes to pharmacy, and pharmacy is supposed to double check, and they double check, and it's still wrong, and they didn't catch it. And then it gets to you, and you're technically like the last line of defense.
Right.
So you need to kind of know your dosages. Like, let's say I need to give, um, I don't know how to translate it because it's all in metric system, but let's say for a baby that weighs like 3 pounds, I have to give this much medication. And you just need to kind of know that dosage. Like, hey, this baby's 3 pounds. Let me do the math real quick on my calculator.
Mhm.
So 50 milligrams per pound. And
You have to
then
do
the baby
convert.
weighs 3 pounds. I'm going to give 150 milligrams. And you just kind of need to just be able to know those things so you don't make an error. And the errors, I think, are the most difficult part. A lot of the times there's twins or triplets. And if you send the wrong like label, so the way we send blood is we draw blood in like a little tube,
Right.
and then we'll send it to the lab. And the lab knows which baby it's for because of the label. And if
Mhm.
you put the wrong label, you know, that's also a huge error. So a lot of the times it's just kind of like about you're the last line of defense. You need to check everything. I think that's the most stressful and most difficult part because if you mess up, and funny thing is sometimes you mess up and it doesn't even hurt anybody,
Right.
you know, so you send the wrong blood, but it didn't hurt a baby, you know. I mean, you got to do it again. So you're taking some of their blood out, you're taking more blood. So I
Mhm.
understand that could probably hurt the baby, but sometimes you can hurt the baby, or it doesn't hurt the baby, but it's still just it's a huge deal because they wonder, hey, if you're making kind of like these mistakes, like what if it did hurt the baby, you know? And so
Right.
you just have to kind of like live with that if it happens to you.
So what's one thing you don't like about your job?
See, I was gonna go back to like why I went to nursing education, but I don't want to disclose too much. I didn't I didn't like honestly that there was like a lot of sometimes drama.
Right.
Okay. Like, and it's not, I don't want to come off as sexist either and say, oh, it's 'cause there's a bunch of girls and they don't like each other,
Mhm.
but a lot of the times I think maybe it's just their age.
Right.
It's just their age and maybe the way they grew up, or I don't know. They just didn't get along. There's so many different kinds of people. I mean,
Mhm.
you can get a nurse who, grew up in, with a silver spoon, and you can have a nurse that worked for everything and maybe they don't get along, or they clash with ideas. But really, I think the thing I like least about my job is sometimes the drama.
Yes.
So I usually hear drama and I'm just like, geez, guys, like that's not important. It doesn't matter what they thought of your nails or, things like that. But I mean, like it happens with everybody, and that's
And it
probably
happens
it.
in every profession, honestly.
Yeah. Oh, and yeah, in every profession. Like even you guys, like you guys aren't even, a lot of you probably aren't working, but I'm pretty sure you go to school and you say like, hey, you only got Air Force ones because I got Air Force ones, and then it kind of goes from there. But yeah, like a lot of the times there's just like drama, and it's with adults too. So
So what skills do you think it is the most important to have to be successful in NICU and the nursery and also in nursing and education?
100% guys, if you're taking care of patients, and you'll hear this from the second that you get into nursing school, all they say is critical thinking, critical thinking, critical thinking, critical thinking. And really, you have to really break down like exactly what they mean. They're not just saying critical thinking and, you've taken all these exams in high school and middle school, and it says like, oh, critical thinking section. You know, the main thing to take away from critical thinking is if things go bad or if things are good, would you be able to use like your training and use your assessment skills to kind of figure out what's going on and catch it? Or can you figure it out to solve the issue? And I would say if you're taking care of patients, it's 100% critical thinking. Let's say, for example, I told you guys before, you either have 1, 2, or 3 babies. Usually the people who get the new babies have 2. But let's say, for example, how about there were 11 babies that had to come to NICU,
Mhm.
and I only had 3 admission spots. What am I going to do with the other, you know, 8 babies?
Right.
And a lot of the time, you just kind of have to figure it out. I can't call the doctor. What's the doctor going to do? He's going to give me some nurses. No, he's just probably going to get mad because I'm calling him in the middle of the night. So I don't call the doctor. So who do I call? I'll probably call my director. I'll probably call to see if anybody wants to come in. Heck, I'll even go tell all the nurses, hey, text your friend, or text so-and-so, like, I know you guys are like really, really good friends. Ask her if she wants to come in. Like, but
That's
you
where
really
the
have to,
social aspect comes in. Good.
yeah, that's a good social aspect. Yeah. And you make really good friends here, uh, especially if like we said, like it's a female dominated thing. I mean,
Mhm.
you're a guy and you're single, like what better field to go into than,
Exactly.
you can meet a lot of people. No, I'm joking, but no, 100%. It's the critical thinking. So you just have to solve the problems like really, really quickly, to obviously no one gets hurt. In nursing education, I would say you probably just need to be able to kind of relate to everybody.
Mhm.
You can't just, I guess, teach somebody something one way, and expect everybody to learn the right way.
Right.
So some people like tests, some people like listening, some people like visual aids, etc. So I mean, I think it's just important to kind of be flexible with the education part.
And I think last of all, with COVID and everything we've gone through for the past year, can you tell us some things that you've learned that are important for parents and students to know as far as uh, care on the job?
Like protecting themselves.
Yes.
Honestly, I think right now you hear all these terms like anti-masker and all this other stuff. Honestly, guys, in the hospital, I think now they're decreasing it to 3 feet, but that might be kind of political. But the studies really show that if you're 6 feet apart and you're both wearing a mask and you're not, exposing yourselves with no mask for, like minimum like 15 minutes, usually you can kind of prevent like spreading it. So for the most part, I would say wash your hands to also not spread it, but for, just basic care. And the funny thing is we sometimes, if we have a patient that's very, very sensitive and the patient is like very, very immune compromised. So for example, we had a baby born pretty much like with leukemia. And I don't know if you guys like are familiar with leukemia, but of course, any little bug that gets to this baby could be, like kind of like a death sentence. Like the baby could just get very sick, not be able to fight it off. And, like that's very, very important. So, I mean, we've gone 12 hours wearing a mask, we've gone 24 hours wearing a mask. So we're already used to it. We're already used to washing our hands. That's the first thing that you do before you touch your babies. So just those like general hygiene things.
Right.
So the hand washing, the mask wearing, whatever, like I think that should pretty much be safe. Don't go out if you don't need to. You never know. Some people, they don't feel good, but they don't believe in masks and they won't tell you, and then you'll just get sick.
Another question, is it really necessary to go to a top school in order to become a great nurse? Or can the education you get from, say, STC, TSTC, TSC, help you in your career?
100%. You do not need to go to a top school. For the most part, nurses are in such high demand, especially now. Like I'm telling you, if you guys all got your RNs tomorrow, you'd be hired tomorrow, right now. Because a lot of these nurses, they were paying the big bucks to go take care of COVID patients in other states. So everybody quit.
I will tell you, I'm writing a report and I just looked it up. DHR right now has 140 nursing, only nursing, not any other openings, but they have 140 nursing openings.
Exactly.
Today.
So, I mean, if you had your RN tomorrow, you'd get in. It even got to the point where a lot of the times they don't take LVNs into the hospital setting. I think a lot of LVNs maybe do home health or things like that. But I mean, they're so desperate, they're taking LVNs also into the thing. And by all means, they never, ever, ever ask you, let me see your transcript. What school did you go to? Where did you get your degree from? If you go on, like, there's a website, Texas Board of Nursing, and they just verify that you have a license. So they'll check there. They'll say, hey, do you have a license? Your license is valid. You can get the same opportunities as everybody else. If I went to, UT and got my nursing, and then someone went to STC, you have the same exact opportunity. You start with the same pay. Just really, I think the main thing that'll go towards your success, I think, is just you. Like if you do a good job, you'll get the raises, you'll get the opportunities, you'll take care of sicker patients because everybody trusts you, things like that. So no, 100%, you do not need to go to like some top tier school at all.
Well, Mr. Abu-Hala, I want to thank you for joining us today. You've given us a lot of good information. I know that this is a very popular subject. Everybody loves babies and wants to know about them. And I think the nursing educator aspect where you're teaching other nurses has been really helpful. So thank you very much for joining us today, and have yourself a good day. Thank you, everyone.
Thank you so much, Claudia.
We'll see you next month. Bye.
All right. Bye, guys.